At our cancer center, I think we have a lot of really great experts, and we're able to offer care that truly gives hope and is really trying to really push the boundaries of what we can do and what we can offer patients. The pandemic affected the ability for people to go and get quality care in many hospitals and clinics. But for many years, we've been offering telemedicine and telehealth to patients, and basically that is a way, a little bit like what you do when you do FaceTime, when you're able to have an audio and a visual communication with your doctor.
My job as the virtual health director is something that not many people are accustomed to. My job is to find ways to connect families, caregivers, patients with their clinical staff in order to promote and deliver care. What we've been able to do is find new and innovative ways to join patients and families, especially during this time with the clinical staff. I think you've probably heard a little bit about the no visitor policy in a lot of healthcare institutions, and that's a huge component that impacts your care journey. And so we've partnered with Patient Experience and found ways to connect everyone together so that nobody is alone during this fight against cancer.
The benefits with telemedicine and the way we do it, obviously in the cancer world, it's a little different than how telemedicine was done initially. Obviously, when you got cancer, there's a lot of there's a lot of more complex type of conversation that needs to happen. So what we've noticed during the pandemic is we're able to care for a lot of patients who ultimately don't need to come to the hospital and be at risk of catching, something, especially a lot of our cancer patients are on chemo or immunosuppressed. And the last thing they need is a virus, which potentially could be life-threatening. So it's been really, really successful. We've seen our numbers of visits go up a lot. And it's not so much because, we're trying to do or to offer something that patients don't want, but the reality is our patients need it, seek it, and a lot of patients are doing it, really, really, really think it's of great value.
And much like the Bucs, Moffitt is one of those key landmark pillars here in Tampa Bay area. And I knew that I wanted to be a part of this community, provide my background in really the consumer software and how to translate those experiences into the healthcare setting.
It's been incredibly impressive and I think incredibly rewarding to see how the Bucs have really been a strong supporter of the Cancer Center for many years. A lot of the athletes, the cheerleaders, anyone affiliated with the team is thought of so highly that when they pass and they just spend a few moments with our patients, you can see the sparkle in the eye and this awe of admiration, and it gives them a lot of joy.
Being able to have the Bucs be part of Moffitt makes it extraordinary and gives the patients an opportunity for a little bit of the ordinary of asking for candy and forgetting about their troubles for just a minute, or having a fan moment and taking a couple selfies. And I think that just goes beyond the patients. I think it also goes for the staff, and it helps highlight just how important what we're doing is.